Hello everybody. I am presenting on scenario 5, so let's get into it. So scenario 5 is the feeding plan the family won't follow. So I'm reading it as the pediatric dietitian for a 14-month-old with failure to thrive who needs a calorie-dense feeding plan with specific fortified formula and pureed meats. At the follow-up visit, I learned the family has not been following the plan because their family follows a strict plant-based diet that is rooted in their religious beliefs about the treatment of animals, and they're uncomfortable with the meat-based recommendations and the formula because it conflicts with their values. But they have said they are open to alternatives, and they have not found one on the care team willing to work within their framework rather than around it. The child's growth trajectory is a genuine medical concern. The physician wants the original plan followed exactly, and I'm the one being asked to convince the family to abandon their religious beliefs or to help find a path that honors the child's health and the family's values. So my first reaction is, of course, I'm concerned for the child's health, but I'm also frustrated that the family is feeling forced to choose between medical advice and their religious beliefs. I don't believe this is a simple non-compliance scenario because the family is not necessarily refusing care. They've said they are open to alternatives, and they said that they have not felt heard or respected. And so this child is having a failure to thrive situation, so I understand why the physician wants the original plan followed exactly, but at the same time, the family is not just refusing care. I believe this is more of a communication and empathy problem, and the Code of Ethics by the Academy supports using evidence-based care while also respecting the patient's values, culture, and circumstances, and they also recommend collaborating with the interprofessional team, and I believe a plan only works if it is medically safe and realistic. This scenario made me realize that my personality leans toward a more problem-solving and wanting to understand the situation. I'm also practical and relationship-centered. I worry about the failure to thrive, but I also do not want to ignore the family's religious values. My leadership style is also problem-solving based because I would want to mediate between the physician and the family and keep the focus on the goal of helping the child grow safely as the main priority. I value both evidence-based care and respect for cultural differences because the best plan that follows all the guidelines may not be sustainable for them if it's not realistic. I would say my learning style is definitely hands-on. I want to know everything that I can, understand all that I can, and get the bigger picture. And then my personal cultural frame of reference is I'm very open-minded about other people's beliefs, their preferences, their religions that they follow, and I know every person's story is different. That is why communication is such a crucial part of counseling patients, because if you don't communicate, you won't be able to get anything done. So some assumptions that have been made is I feel providers may label families as non-compliant too quickly. The Ethics and Practice article gives a similar example on page 828 where the RD questions whether calling a patient non-compliant implies bias. Instead, it's recommended to gather more information to see what the barriers are. So there may be barriers, beliefs, or misunderstandings that are involved. And so non-compliant can make the family sound careless when they really may be trying to do the best for their child while also staying faithful to their beliefs. I would want to ask what made the plan difficult to follow for them, what alternatives they're open to accepting, instead of assuming that the family does not care. So what is unresolved? I think whether or not a fully plant-based plan can safely meet the child's calorie, protein, vitamin, and mineral needs. So I would want more information about the child's intake, their growth, their labs, their feeding skills, any allergies, food access issues, and the family's specific concerns about the formulas. I would want to explore more plant-based pediatric formulas such as Complete, Kate Farms, Orgain, soy-based, or any modular supplements that might be appropriate. There's also nutrient-dense plant-based foods that I would discuss, like nut butters, oils, avocados, coconut milk, tahine, grains, legumes that could add calories and nutrition to her diet in conjunction with the formula. Since this child is 14 months old, she can have solid foods and table foods, so I would want to make sure those foods are calorically dense in addition to the formula. So if I were still the RD after a week later, I would follow up with a weight check, review her intake, ask the parents what they were able to do with the previous rec, so any successes. If the child's growth has continued to decline, I would be honest and clearly explain that her medical risk is increasing while still trying to respect the family's values, because I do not want to ignore the danger here, but I want to work as hard as possible to find a safe option within their values while being transparent enough if those options aren't enough. So for interprofessional consultation, I would involve the physician and ask for a little flexibility and being open to collaboration here. I would also possibly consult a pediatric gastroenterologist if there are concerns about absorption. Besides the diet, possibly speech-language pathologist or feeding therapy if feeding skills are an issue, and then a social worker if access to food or stress, or they need family support if needed. So the RD's role here is ultimately to protect the child while preserving trust with the family. You want to build a good rapport with your patients, and especially with pediatrics, the caregivers. And so the RD's role here is to create a plan that is evidence-based, culturally respectful, medically safe, and realistic, so that this patient can thrive, the parents can feel capable of helping their child thrive, they feel seen and understood, and the physician is happy because he's seeing success with his own patient as well.